Hi, I'm here at the Renal Services Home Dialysis Clinic here at the Nanaimo Hospital. And we are just about to go on a tour with Kelly Ann Van Hest. She's the home dialysis nurse clinician, and she's going to lead us through what patients who want to do home dialysis, the type of education and skill training that they need. Plus, we're going to get a special demo of the types of equipment that these patients need when they do home dialysis at their home. So don't go anywhere. Hi Kelly Ann, so nice to be here today. Thanks so much for having us at the clinic. I understand you're going to take us on a bit of a tour.
Yeah, welcome to our home dialysis clinic. We're here at Nanaimo Hospital, and we look after patients who are doing their dialysis at home, both hemodialysis, peritoneal dialysis, which we can talk about later, and we also train people to do their dialysis here, so I'll show you around. We have a waiting reception room here for when our patients are coming to see us for their checkups. They'll check in here. There's lots of information for them to look at while they're waiting. They'll come on in and they'll check in with our clerk, who's not here at the moment. We also have the nurses sitting in here all day long, answering telephone calls, reviewing blood work.
So this is sort of the main...
we call it the nursing station.
The nursing station, yes. The first thing that happens after the waiting room.
Right. We have an office for our dietitian. It's a multidisciplinary clinic here, so we have nurses, doctors, dietitians, social worker, and she works in this office here.
And so when patients come in, do they visit each of the dietitian, the social worker? Is it part of all one? All of one? Okay.
Yep, they'll see everybody. This is a clinic room, we call it, where a nurse may sit with a patient and review how they're doing with their dialysis at home. And we have our social worker office. She's not here today, but she is available every time they come to clinic for a patient to see, talk to, and also follow up by phone.
So this is really like one-stop shopping.
It is
very convenient for the patient.
Patients will continue on through the clinic if we need to do any specific kind of procedure, like a dressing change or anything. We have a treatment room here. We could also even do some peritoneal dialysis in this room if we needed to for a patient. So that's our treatment room.
Very good, very good. And
we have physicians come to our clinic to see patients, and this is a physician room here. So a patient may see the nurse, the dietitian, social worker, and then come on in to see the physician, and he'll use all the information, or she will use all the information that we've gathered, and
so do they
make any
often
changes.
see the nephrologist at the end of a visit once all the other...
That's how we think it works best.
Right.
We aim for that. We have some rooms back here that are just utility type rooms and offices. We have a couple of training rooms on this side of the clinic, and we'll use this room typically to help people learn how to do their peritoneal dialysis, and we'll use this room here to teach patients how to do hemodialysis at home.
Now this is interesting.
As you can see, we have two different kinds of hemodialysis machines. We have an AK96, it's a Gambro machine, and we also have something called the Next Stage machine. So there's two options for people doing their hemodialysis at home.
So if someone does it at home, is this the equipment that would be in their home?
The only equipment that would be required to be in the home is the actual machine. They do not have to have a special bed or a special chair or a special kind of a table. This is the furniture that we have in our clinic.
So that would be this right here that they would need in their home, is that?
That's correct.
Okay. Okay. And if does someone come and help set up in their home, or is that all part of the training too?
When somebody comes and learns how to do their hemodialysis at home, they'll come to this room and work one-on-one with a nurse until they're comfortable with all the steps and procedures. And once that's happened, a tech will bring a machine to their home. In fact, it may be the machine they've been using in the clinic, set it up for them, and we organize all the delivery of their supplies, and then they're able to continue their hemodialysis in their own home.
Wow.
Some people will have hemodialysis while they sleep, so they would be in their bed.
Right.
Some people will have a chair set up in their living room, perhaps, where they do their hemodialysis.
I'm just looking at it. It looks a bit overwhelming, but I know with the training for people, it probably becomes much easier, right?
It typically takes 4 to 6 weeks of training until someone's comfortable doing their hemodialysis at home.
Right.